In our very last lecture for AMP2, we will wrap up by talking about a few clinical applications for the male and female reproductive systems. I'm just going to give you an overview of some of these common conditions. For the males, we'll look at testicular cancer, BPH, benign prostatic hypertrophy, prostate cancer, and impotence. When you look at testicular cancer, this is a cancer that's more common in younger men, so roughly ages 20 to 35 years. And basically you would have a tumor that would be palpated on the testes. So it is important to do testicular self-exams to catch these, because if they're caught early, then they're highly treatable. But if they're caught late, as in any cancer, it can spread to other organs in the body. So common signs and symptoms would obviously be a lump or swelling in the testicle or an ache. There's different diagnoses they can do, ultrasound, and then the treatment is usually going to be a typical cancer treatment, either probably remove the tumor. They can also do radiation and chemotherapy to treat this. BPH, we talked a little bit about with the urinary system. We have the prostate gland, and we know that the urethra travels through the prostate gland. Now, it's called benign prostatic hypertrophy. So the prostate gland is enlarged, and when it gets enlarged, it can pinch off on the urethra. And so what will happen is the male will have a full bladder and urge to urinate, but when they urinate, they'll have trouble getting that stream going and passing that urine because the urethra is pinched off by the prostate gland. A lot of times they can give those alpha blockers. We looked at these for blood pressure because they block norepinephrine. They block that alpha-1 receptor, which makes smooth muscle relax. The urethra has smooth muscle, so this can open up the urethra to allow the flow of urine more easily. So typically you'll see issues with urination. The prostate gland can be palpated through a rectal exam, and then you can see some of the risk factors for this. Now, prostate cancer, on the other hand, is cancer that starts in the prostate gland, and because there's so many other organs and it's vascular, it can spread fairly quickly. It is one of the leading cancer killers in males over the age of 72. You can palpate the prostate gland again, and then we do a blood test called PSA for prostate-specific antigen. It's not the perfect test. It's not always highly reliable. However, it's good to get a baseline in your 40s so that if those levels start to go up, it could be an early indicator of prostate cancer. And the treatment for this, again, would be radiation and chemotherapy. And then impotence, you can have erectile dysfunction or ED. There's different treatments out there. The most common treatment is the meds, the Viagra and Cialis. These basically allow the production of nitric oxide, which is the vasodilator, which will allow for the penis to become erect. You can see some different causes of it. A lot of times it can be vascular because we know it's a blood supply. Sometimes it just happens with aging, and you can see some of the causes of this. When we look at the female, we'll talk briefly about the ovarian cysts, the ovarian cancer, the cervical cancer, as well as the breast cancer. So what is a cyst? Basically, when you release the egg, the oocyte, each month, sometimes those stay on the ovary. They don't get sucked up into the uterine tube and leave, so they grow on the ovary. They can grow inside the ovary or on the outside, so they're basically a little sac or pocket. They do have DNA in them. These are oocytes, so sometimes cysts have hair and teeth in them. It's just those genes being expressed. But usually you'll start to have some pain with the cysts. They can rupture, which can be very painful. So sometimes they just disappear on their own. If they're really, really large, sometimes the birth control pills can help suppress the estrogen, or they can go in and remove them if they're large. They're usually seen on an ultrasound. And again, you would have typical signs and symptoms, which, a lot of these are typical signs and symptoms of any problem in the female reproductive system. But the idea is that the ovarian cyst is not cancer. If it becomes cancerous, now we have ovarian cancer. So now we have the cysts that are malignant. And so these can spread, they can metastasize. It's very difficult. A lot of times ovarian cancer is caught later, not as early. And when you're doing the ovarian cancer, there is a blood test they can do to try to catch it early, but typically you're looking at doing an ultrasound or an MRI And you can see some of the common signs of ovarian cancer. So if you have these, it's always good to get it checked out. Better safe than sorry. Cervical cancer is the one that's checked with the Pap smear. So hopefully you're able to go and have your annual exams, and they'll take a little sample of cells and they'll look for any precancerous cells, which is called dysplasia. And dysplasia is not cancer, it's considered pre-cancer. And if you have that, a lot of times they can go in and they can just like laser it off and get rid of it. It is associated with HPV, human papillomavirus, does increase the risk of cervical cancer, and that is spread through intercourse, unprotected intercourse. As with every cancer in the body, smoking also increases the risk, but as long as you can get the regular Pap smears, you should be able to catch this early and it's treatable. Breast cancer is one of the most common cancers in women over 50. You can see typical age range of death from breast cancer. There are some genes, the BRCA1 and 2. We know that there is a genetic component. About 10% of all breast cancers are due to these genes. So if it runs in your family, you might want to get tested. You can get tested for these genes. And if you have them, you might actually do a mastectomy, because if you have these genes, it's pretty likely that you're going to end up with breast cancer. You can see some of the risk factors for it. We're looking at first pregnancy after the age of 30. HRT is hormone replacement therapy. And then our lifestyle, what we eat, if we smoke, all of this can increase the risk of breast cancer. And again, you can remove the breast tissue, the cancerous tissue. There's a lot of lymph nodes near the breast, so this can metastasize fairly quickly. You can see the 5-year survival rate for this. So what that means is the chances of being alive in 5 years. So if they catch it in stage 1 and it's just in the breast, 5-year survival rate, 99%. If it's stage 3 and it's metastasized, the 5-year survival rate drops to only 26%. So this wraps up our summary and overview of some different diseases and conditions of the reproductive system.